Have you heard of swimmer's ear? Did you know it's different to surfer's ear? Let's talk about swimmer's ear. Swimmer's ear is an infection of the outer ear, so specifically the ear canal. It's actually also called tropical ear, and the reason for these two names relates to the reasons why people get these infections. It can be related to exposure to dirty water, or it can be related to heat, humidity, sweat, and so forth. When it comes to outer ear infections, their proper name is otitis externa. Bit of a mouthful, but I'm here to show off, so there you go. When it comes to these outer ear infections, they can be often due to a bacterial infection, but occasionally a fungal infection. And sometimes it can start as one and then end up as another. And that latter situation usually occurs when antibiotics are given to clear up one infection, and unfortunately the second one then comes into play. Most of the time with outer ear infections, they will respond really well to simple antibiotic or antifungal ear drops prescribed by your GP. If, however, there is a problem with the response, then you may end up needing to see a specialist. And these infections can be quite painful, so sometimes you can even end up in hospital needing pain relief. If you end up seeing the specialist, they will probably use a special instrument to remove the infection. Now, to do that, they need to see. So the first thing we use is what's called an operating microscope. So this is a special microscope that allows us to look into the ear to make everything nice and big. Because we're talking about working in fractions of millimeters when it comes to working in the ear canal. When we deal with this, we use a suction type machine to then basically vacuum clean out the infection. And then we may need to pack the ear with special sponges or ribbons, and then put medications onto these to help clear the infection up. For some people, it can take us a while. So if you end up with an outer ear infection, you'll pretty much know about it pretty quickly because the pain's pretty intense. Often your GP will be able to sort it out, but if you end up needing to see a specialist, then you've got some ideas of where you'll be heading in terms of what to expect. Have a nice day.